She used to tell me I was going to be a doctor, which is weird because nobody in my family is in medicine. I matched for general surgery in Brooklyn, New York, and that program wasn't giving me everything I needed. I transferred to the University of Nevada in Las Vegas. They had a really well-known plastic surgeon there, and I knew I wanted to do plastic surgery, and I wanted more experience with other types of surgery. I've done a lot of revision breast surgery lately, where it's people are coming to me and they've had breast surgery with someone else, or something's wrong, or they're trying to change something. I want everything to be perfect, but there's those patients that I'm like, this has to be the best it can be and as perfect as possible. So if you're a mommy, it's the best nap you'll ever have. And that surgery is like 8 hours that goes by so fast, and you're asleep the whole time and you wake up feeling very refreshed. The side effects aren't too bad. We're not hurting anyone. I think we are actually helping people by decreasing heart disease, diabetes, all that stuff. There's a lot of information that's been coming out with implants and their associations with autoimmune disease or cancers. I think autoimmune disease is just more prevalent.
It's just more prevalent in
general.
people.
I'ma kick back when you fake back.
Welcome back to Beauty Unveiled. Today you'll hear from Dr. Ashley Steinberg. Her journey took her from New York to the University of Nevada and finally to the Houston Medical Center. We'll talk about her journey on becoming one of the best plastic surgeons in Houston. So if you enjoy this episode, subscribe to the show and share with your family and friends at drangela.sturm.com.
Thanks for having me.
Thanks for coming.
Let's do this.
All right. So start. Purple hair. Why purple hair? When did this start?
To be honest, it started because someone told me I couldn't have it.
I love it.
A former job said the employees were not allowed to have hair that was not a natural color. And I said, well, it's a good thing I'm a doctor and not an employee. And I had it. And then I've multiple times tried to change it. I've had pink since. I've gone all blonde. But every time I do that, my patients get upset. Mm-hmm. And they'll come in and be like, where's the purple? And so I just kept it because I feel like it's my personality now. But children love it. Like the compliment I get the most is like, someone's like, oh my God, my 12-year-old would love your hair. And I'm like, cool, exactly what I'm going for. Thank you.
Oh yeah, I'm sure my kids love it.
Yeah.
Pink, purple,
I think that's why they come in my office all the time. They think I'm their age or something.
Yeah. And they're usually looking for snacks. They go in everybody's office looking for snacks.
And I always have them. They're smart.
See, smart girls. Okay. So why medicine?
That's a good question. I feel like my family members, my grandma June was a very big influence on me. She passed away a long time ago. I was 16, but she used to tell me that I was going to be a doctor. She brought home a little Oxford sweatshirt because my aunt used to live in London, and I was 4. I remember the sweater being like this tiny little crew neck, and she brought it home and she was like, you're going to go here for medical school. And I was like, okay. And I just feel like since then it was subliminally played to me. My mom whispering in my ear or something. And I just feel like that's always what it was going to be, which is weird because nobody in my family is in medicine.
Yeah. They just decided you're the one.
Well, yeah. And I mean, I did well. I was a big nerd. I did well in school. I guess that's what people think. And I mean, I liked it. And then when I turned 16, I watched a plastic surgeon operate, and I was like, yeah, this is cool. This is it.
What was the surgery?
It was a tummy tuck. I just thought it was really cool to see that immediate change. And then he showed me how to suture. And then I watched nip tuck after that and was like, cool, I want to be one of these guys on nip tuck.
Yeah.
Turns out it's not really like that, but.
But it was the good direction.
Yeah. It was an interesting show. Yeah.
So you went to a few different places. Okay, tell me about your training, because I feel like it's a map, and I try to follow it in my head.
Yeah, so I went to medical school in the Caribbean, actually, and 2 years of that was clinicals in New York City and Brooklyn, and then I matched for general surgery in Brooklyn, New York, and that program wasn't giving me everything I needed, so I transferred to the University of Nevada in Las Vegas. Luckily, my mom lives in Vegas, so I lived in my mom's guest house. She would have dinner for me every night. Nice. But they had a really well-known plastic surgeon there, and I knew I wanted to do plastic surgery, and I wanted more experience with other types of surgery. So I transferred there as a 4th year, and I was there for 2 years, and then I matched in one of my top choices for plastic surgery, which was Houston Methodist here in the medical center, biggest medical center in the world. Houston Methodist is like a gem. It's always top I don't know, 50 or something hospitals in the country or something like that. And it has some of the best plastic surgeons and one of the best programs. So that's how I ended up here. And I interviewed a bunch of places to work eventually, and I decided to stay because Houston's easy.
Yeah. That's a great place to live.
Yeah.
Good place to practice, good place to live.
Compared to Vegas and New York?
Yeah. Much easier. So what was Vegas like as a resident? Because you're kind of a young person. No?
Vegas is the worst. So everyone's like, ooh, Vegas. Like, no, you can go there for 2-3 nights. You're just on the Strip and you don't experience anything else. It's completely different. So off the Strip is just a little like 5 miles of Vegas. I lived in a suburb that was 8 miles away, which is just like any other suburb. And it was very boring, and every person is transient. So dating there was horrible because it was like, oh, I work shift work at night, or like you make a friend and they're moving somewhere because they got fired from their blackjack dealing job, or, you know, everybody works in the nightclubs or something like that. So it was really hard to make friends outside of medicine. And then, I mean, the training was really good because the amount of trauma in Vegas is insane.
Oh, I bet.
There was some stat that 25% of people on the road at any one time in Las Vegas are over the legal limit of alcohol, which is
believable.
Horrible. So a lot of motor vehicle trauma, and then it was like a knife and gun club, which is interesting because the penetrating trauma, I mean, people think that probably sounds bad, but it's actually really good for training wise. Not a lot of places have penetrating trauma, so knives and guns, and I actually saw a lot of that and treated a lot of it. And that was kind of fun and like a really good learning experience. So, I mean, I got what I needed and what I wanted out of it, but I was like, no, it's a wasteland. I'm not staying.
You're not going to live there. So my 3 days in Vegas is a good rule.
I think 3 is, max. I can't even do it anymore. Like, I didn't even go to the Strip when I was there. It was, you'd have to drag me. It's, I mean, and if I'm going to go, it's going to be for some like Michelin star restaurant or something. Not for
for the food.
No,
I'm too old for that. That's for sure.
I have a headache thinking about it.
So favorite procedure?
I think it's hard. It keeps changing. I think all things breast, I'm pretty well known for that, but I've done a lot of revision breast surgery lately where it's people are coming to me and they've had breast surgery with someone else, or something's wrong, or they're trying to change something. I like a challenge. But I do like a good mommy makeover where I'm doing a full body something and someone's come in and they've worked really hard and they lost all this weight and they did all the work and they just kind of have to uncover it. But just, you know, anytime a patient comes in and feels differently about themselves, it could be like the smallest little thing. I'm like, oh yeah, okay, that's why I do it. And suddenly my favorite procedure changes. It's whatever that person's happy about that week.
Because you get excited with them. And you're like, yay, you're
I'm
excited.
like, oh this is why I do it. That lipoma that's been bothering you for 5 years that took me 30 minutes. I love that procedure. I do love those though. It's just so
gratifying.
Satisfying. And you're just like, bloop.
So what do people come in with most with the breast revisions? What's the problems that you see that you're fixing?
Revision wise, so I do reconstructive revisions and I do aesthetic revisions. So I have patients who have had breast cancer in the past and have had breast cancer surgery. Cancer's gone. They had a reconstruction and they either had an implant reconstruction or an autologous reconstruction, and they just are happy, but they're not pleased with the aesthetic appearance. So it's more of the aesthetic side. So of course, the breast cancer reconstruction surgeons do a great job, and a lot of them are very aesthetically inclined. But as a surgeon who is doing 80% aesthetics, my breast cancer reconstruction aesthetics, I think, are a little more honed in, just because that's mostly what I do. So it'll be a little bit of tweaks here and there, because, you know, these women, they go from having the breasts that they want, the breasts that they like, and then they have breast cancer and it's all taken away. So they kind of want the semblance of that back. But also, I tell them, I always say the silver lining is the opportunity to have insurance pay for you to have the best breast you'll ever have. So let's just do what we can to make you happy. So I do a lot of very small things just to make things not perfect, but as close to it as I can. And then some aesthetic breast revisions as well, which are usually the harder ones, patients who've had 5 surgeries of somebody else. And I'm holding my breath and I'm like, oh my God, is this going to be okay? Like, why am I going to be the one that's going to be able to fix it? And I'm in the operating room going, oh my God, I hope they like it. And they come back and they do. And God, I'm like holding my breath until that 2-week post-op visit. But yeah,
everything's good. So after cancer, do people usually want like the breast that they have, or are they like, well, can we make them a little better? Or at that point, they're just like, I just want to be back to how I was, just giving myself back.
It's different. It depends on the stage that you meet the patient in. So before, when I was working down south in Clear Lake, I did some immediate breast reconstruction where I was doing it at the exact time of mastectomy. And I was able to do a direct to implant where I could basically, they'd wake up and they'd have augmented looking breasts. And so those patients wanted it to be a little, maybe a tiny bit bigger, tiny bit rounder, a little less natural, and they could have that augmented look. Whereas now sometimes they are asymmetric and they're like, I just want to look more similar in clothes. I hate that one's down here and one's not. Or, some of those people are striving for breasts nothing like they've ever had and more towards perfection. Obviously harder to please, but I do my best.
So what's that's obviously mentally like the hardest, but like physically, what's the hardest?
So surgery, I honestly, for some reason, it's those breast reconstruction revisions. So I tend to overbook time for all of my aesthetic procedures because I'm always worried, like I don't want to back up the OR or something like that. And I always end up finishing early, except for breast reconstruction, because I have this, I want everything to be perfect, but there's those patients that I'm like, this has to be the best it can be and as perfect as possible. So I'm sitting them up, laying them down, having everyone in the room tell me, is it like a little bit different? Do I need to do a little something right here? And I'm like tweaking it a million times, and I tend to go over on those cases. So yes, mentally and physically harder, but physically exhausting is liposuction.
Yeah.
Like full body liposuction. I have
the workout.
Oh yeah. I have my Apple Watch on up here out of the sterile field, and I get like a 500 calorie workout when I'm doing liposuction or like a full mommy makeover. You're in this one OR, one spot, yet the amount of exercise you do is crazy.
Just from the moving the wand
it's exhausting.
So much. So I'm sure people want to know about mommy makeovers. I've like picked your brain and gotten scared a million times. So make it less scary. So tell us when you say that, like, what does that mean?
Well, let me tell you, if you're a mommy, it's the best nap you'll ever have, because I know you haven't had one since you have had kids, and that surgery is like 8 hours that goes by so fast, and you're asleep the whole time and you wake up feeling very refreshed. But a mommy makeover is any combination of basically breast and body procedures. So it's not specific procedures. It can be a breast augmentation and a tummy tuck. It could be liposuction and a lift. It's just any combination of the two or more to kind of get you back to pre-baby body.
Yeah.
So
pre-baby
or better, yes. And you don't have to be a mommy to get one. Like I'm not a mommy, and I'm already planning mine. So it's especially with the weight loss that's going on right now with the medications. We're having a lot of patients who have had significant changes in their body with the weight loss that are coming in for these makeovers before or never having had children.
Yeah. So do you think that trend's going to continue? Because I'm sure people are going to continue on the Ozempic and Mounjaro, and
and I'm all for it. I think if it's making people healthier in the long run, you probably know insurance does not want to pay for anything, and they should see this as long as the studies show that there are no problems with it, the side effects aren't too bad, we're not hurting anyone. I think we are actually helping people by decreasing heart disease, diabetes, all that stuff,
joint problems,
like all of it. People, I have one patient who swears by it. She's like, my hands don't hurt, my legs don't hurt anymore. She's like, I'm staying on this forever. And people give it like, oh, this is the easy way out. Whatever, man. We've tried everything. People have been on, people were on fen and having like heart attacks, and it's better than that. It's better than phentermine. It has like a lot less side effects. It's doing well. I think that as long as we don't have any data that's showing really negative impacts and consequences, it's going to continue. And I don't think there's anything wrong with that.
Yeah.
It's just going to lead to more plastic surgery. People have to realize that once you lose weight, there are consequences to that. And that plastic surgery isn't covered by insurance most of the time.
Right. There's the skin that just doesn't go back.
Yeah, exactly. Especially as we age.
Yeah. The babies, the weight, all the changes in your body.
Yeah. We have to get in
go
front of age. That's where you come in mostly, and I come in secondarily. Yeah.
Yeah. Fix it. Put it back up.
Yeah.
Where it's supposed to be.
Yeah. Fix my face because that's what everyone's looking at first.
Yeah.
Face and hands and
Face and
neck.
hands.
Right?
Right.
Neck.
The neck gives it away.
Yes.
Always.
Hands and neck is where it's at.
Yeah, I agree. If you can make the hands look nice and smooth.
Yeah. Let's throw some filler in your hands, make them look youthful, and get that facelift early.
So I feel like I've talked to so many people. They ask me questions and I'm like, I don't know. And I just send them to you, but that are wanting to take their implants out. Like what is the reality with this?
There's a lot of information that's been coming out with implants and their associations with autoimmune disease or cancers. So this started a few years ago with something called ALCL, which is an implant-associated lymphoma. It's only been associated with cases of textured implants or anyone who's ever had textured implants. So one time there was a recall notice of textured implants where Allergan sent out letters to everybody who's ever had these implants and said, hey, just so you know, there's an association. It did not mean, hey, take out these implants. It was just like, hey, watch out for these symptoms. But now the FDA, I think a week or two ago, just came out with, if you want to have your implants out and they're textured, we're okay with that. It's a very soft kind of recommendation. It's not, if you have those implants, absolutely get them taken out. Before we were telling people don't take them out unless they're causing a problem. Now it's like, it's reasonable, even if they're not causing a problem, to take them out. There has been some also recent studies, recent cases of squamous cell in patients with breast implants, and that has been smooth and textured implants. It's very, very few patients, but whenever we associate something with a breast implant, it's very polarizing and sensationalized because breasts are very fun to talk about.
Yeah.
So of course they hear cancer, breast implants, and it becomes a very large thing. It's a very, very small amount, but it can happen. And then there's also breast implant illness. That's a big thing that people talk about. And, it's a real thing. There are definitely symptoms that are associated with breast implants that even some people who don't have breast implants have those symptoms. And I would say, a lot of people will get their breast implants out and feel better, but a lot of people will get their breast implants out and feel the same. Or they'll regret having them out and wish that they didn't.
Yeah.
So, I think it is a real thing for some people. And it does help them and it does change their lives, but I don't think it's necessarily the cause of these feelings and things for everybody.
Well, and we're seeing so many more people with like autoimmune disease, things like that. It could be that, like
I think it's just in general, there's been some association of implants and autoimmune disease, but it's more of a correlation thing than anything. I think autoimmune disease is just more prevalent.
It's just more prevalent in people.
Yeah.
And people that don't have implants, just in general, like we're seeing it.
But it is
very
reason. Sexy to say like, oh, implants cause something, or what I mean?
It's just people want to pass judgment on, oh, did you do this? That was
people
a bad
just want to
idea.
talk about boobs. I think like I want to always talk about boobs, and so I get it. But I just think like the lay people want a reason to talk about boobs.
Well,
and that's cool.
You give them a reason.
Whatever. Yeah.
And I think the aesthetic seems like it's changed, and you can speak to that more than me, because I have people that are like, oh, I really wanted these really big, and now
I've had that lately. I kind of love that. It's very different. It's very geographical. Patients on the East Coast and the West Coast, I would say, so your California, your New York, New Jersey will have much smaller implants. My average implant size that I place is in the 400s. I would say on the other coasts, you're looking in more of the 200s. When I have a patient who gets something in the 200s, I get very excited because it makes surgery easier. I'm not worried as much about complications like with wounds and open incisions, because the more pressure with the implant we put on the incision, the more risk of complications, things like that. But we are in Texas where everything is bigger.
Yeah.
So patients tend to have that different aesthetic here, but I have had some people recently say, hey, these are just too big. I want to go smaller. And I like that. That's more my aesthetic, but I work for the people. So whatever you want, I will give you.
Yeah. And I've seen people talk about that on like the BBL side Of like, that was a big thing for a long time, and people are going, are you seeing that they're not as much, or it's still...
I feel like people don't talk about it as much. It was very talked about many years ago, again, because it's plastic surgery and it's a butt and it's polarizing and that's just what it is. But there were things about deaths after BBLs. That was a big thing. And it was because we first started doing them. They injected into the muscle and there's blood vessels there and fat embolisms and stuff. So much research has been done. We know how to do it safely. It's reduced the risk so much. There are definitely centers where people go to get BBLs. There are surgeons all across the country, very good board certified plastic surgeons who know what they're doing, who are doing these often.
Not in a back room in Miami.
There are those too. There are the back rooms in Miami. There are the Mexico. There are the Dominican. And as I was telling you yesterday, a week does not go by that I'm on call that I don't get a call about someone who traveled outside of Houston for surgery and has some sort of infection or issue because they couldn't find a good surgeon in Houston, where Houston is basically equivalent to LA, New York, San Francisco. We have some of the best surgeons in this city, and we have some of the most population-wise. And they're amazing surgeons here. So.
Yeah, there's some incredible surgeons, and they... same level as you'll find anywhere.
Yeah,
but
or better.
But people travel, and then when you travel, then that's the problem. Is if you have a problem, your surgeon's not there.
Yeah.
Are you going to be able to travel back to them to take care of that problem?
Yeah,
or no?
exactly. Because they had a friend that had it done and everything was fine.
Yeah, and it's dealing with people.
Yeah.
So there's things we can't control.
And that's what I say. Part of what you pay for with us. I mean, I know we have the same phone systems. We have the same kind of thing with our patients. You can contact us all the time. My patients text me at 11 o'clock at night and they answer, or I answer, and they're always like, why did you answer me? And you texted me. What did you expect? Of course I'm going to answer.
I would rather know and make sure
that's
you know.
That's what I say.
And
I'm going to be much more upset if you come back 2 weeks later and be like, this happened to me and I didn't want to bother you.
Yeah.
Like, please bother me and let me fix it.
Yeah, exactly.
So.
They're like, I've had patients that were like, oh, I swallowed my nasal packing and I called the 911. I was like, call me. Why didn't you call me? Just call me.
That sounds very uncomfortable.
I know. It's like, oh my gosh. She's fine.
I'm just thinking of like a Doyle splint.
No, it's just like a little gauze. It was like soft.
I was like, wait a second.
No.
Ooh, I had one of those. Watching that come out of you is just like, how was that inside of me?
I know. Everyone looks at it like, that's really big. You're like, yeah, the nose is actually bigger than you think.
Yeah. Yeah.
I think all these things tie into your personality, and being female helps, of like the way that we interact with our patients. I think there's a difference, and the things that we've been through to be here, and then the way that we relate to our patients. Because I feel similar as I feel to my kids, and you probably feel similar. Like, you want to make sure they're okay. You can call me anytime if there's anything you need.
I always tell them, because they'll ask me if I have kids, and I'm like, you are my child.
Yes.
Like, my patients are my children. I always say I'm a helicopter doctor. Like, I need to know everything. You need to tell me everything. And it is, I mean, there are some great male plastic surgeons. There absolutely are. There are some bad female ones. But I do think that females approach things a little bit differently. 90% of the people who are getting plastic surgery are female. And I mean, I think probably less in your field, but the last statistic was around 2020 where it was 16% of plastic surgeons were female. I think it's rising definitely. And that was like ASPS statistics. So that was the full body plastic surgery. I think facial plastic surgery is less.
Yeah.
So, I mean, we're in a field where it's male dominated in the physician aspect and female dominated in the patient aspect. So the dynamics are very different, and sometimes it's for the good and for the bad, because sometimes it's like this patriarchal thing where people expect to be told what to do and walk in and expect a man to be like, you need this, this, and this, whereas I know, I'm pretty sure you're the same as me, where if someone's like, tell me what I need, I'm like, tell me what bothers you, because I'm not going to point out something that you never noticed.
Right.
And now you're going to you're constantly just going to look at that and never think about anything else and be pissed that you didn't even know it was there.
Yeah. And I'll tell them, like, well, nobody needs anything, but we really like it.
Yeah.
And we want it.
Yeah.
And we want to look good.
Yeah.
Because that annoys me, too. I've had people that were like, and your bunny lines, and you need to inject this and this. And I'm like, stop. Can you stop?
Yeah. Yeah.
I'm fine with those, actually.
I find that much less in females. It's just I almost said a little less aggressive, but I'm one of the most aggressive people I've ever met.
Aggressive in a very nice way.
Well, in a different way. But I would just say, like, I sit and listen. I spend a lot of time with my patients because I think the mental aspect of plastic surgery is so much more important than we give it credit for. Mm-hmm. So.
Yeah, I agree. Like what you give to that person and how they can, like, feel better, like, it's a huge deal. You know? I think the mental aspect in all aspects of, like, recovery, how difficult is recovery? It's actually quite difficult, you know. And then how great do you feel on the backside? Like, it's can be just as intense in a positive way.
People don't realize that there is a bit of a downward spiral in that first 2 weeks after plastic surgery. It can become a little bit depressing. I mean, there's literal graphs, and part of our ASPS consent is like, here's the graph of what your emotions are going to be like after surgery. It's like, I'm so excited I did this. Wow, why did I do this? What was I thinking? I hate my doctor. I hate everything. How could I have done this? Oh my God, it's looking better. Oh my God, when can I have my next procedure?
Yeah.
You know,
you go through that because you want to look better, and then you look in the mirror and you're like, wow, that's worse before. So
immediate gratification only for you and me.
Yeah, because we're like, yeah, it looks great, and you're day 2, and that's what it's supposed to look like. And they're like, are you sure?
Yeah, that's why I did it at first. I was like, ooh, immediate gratification. I love this. And then I'm like, oh, it's only immediate for me. Like, I see what I did, and I see what it's going to turn out. Because on table, it looks awesome. It looks right amazing. When we're done. And then the moment we look away, swelling, inflammation, bruising, all the things that make you look worse and feel worse happen. And that's what the patient goes home and deals with.
And then they see, and they're like, oh my gosh, is this, you know, and then you go through why did I do this? But then, like you said, then you come out and you're like, okay, this is good.
Yeah.
It's on the first 3 days are rough.
Yeah.
And then it starts to come back up. And then
that's why I always, for you, it's the first 3. Facial swelling is usually the first 3 days.
Yeah, and it gets better fast.
Body is way worse, especially liposuction. I'm like, give it 6 months before you even get happy. Like, right after surgery, patients' implants are in their clavicles, and they
miss that when they're gone?
Sometimes they do. Sometimes they think they look like Frankenstein, but sometimes they wish that they were back up there. And if that is the aesthetic you're going for, you just have to say that. There are different types of implants that will leave you looking like that for longer.
We were talking earlier about, like, mentors and sponsors and stuff, and I just real quick did want to kind of get into that because I think that's good, and especially for anyone who's thinking about getting into this or whatever. How do you think we could do better with that in medicine? Because I know we were saying, like,
I didn't even know. She didn't mention, but I had to ask what a sponsor was. I was like, what's a sponsor? I know what a mentor is, and she had to explain it to me off camera. And you shouldn't actually probably explain it because if I
So we're talking about, like, mentors and sponsors, and mentors are the person you go to and you can ask questions and things like that. I think everybody knows. Sponsors more that person that's talking about you in rooms that you're not in, that will put you up, say, I want to be on this board, and they say, oh, well, Dr. Steinberg would be amazing, or, you know, I want to do this, and they help you do that, and they're more active in the process of putting you into, like, leadership roles. So as you can tell, like, I don't think we do a great job of that in medicine, and officially, like, I think we unofficially will help out people that we like, you know.
It's really hard in an elective field like plastic surgery to not be competitive with other people. And I think that's a big deal. I think Houston, we are very lucky in the plastic surgery community that we are more colleagues, less competitive, but there's always competition. So it's always going to be harder to find someone like that.
Yeah.
I've been lucky, like I told you, that some people will speak my name, and I'm so humbled by it. And I will do that for others. I don't want to label myself because I don't like it as a feminist, because I just believe things that I believe, but one of those things I believe is that women are much more likely to come to your sponsorship rescue, but I also think they're much more likely to talk shit, you know?
It goes both ways.
It does go both ways, but I think men are usually a little more like self-serving and just like not, and they're not going to, they might say something bad, they're not going to say something, they're not as petty and not as dramatic, but they're also not going to come to your, like, let me have this person do it. I mean, there definitely are a few, and I can think of it off the top of my head. But, it's especially hard in competitive fields like ours.
Yeah, where everybody's technically a competitor.
Yeah.
Well, thank you for coming on today. This was awesome to get to know you even a little bit better.
Anytime. I love to talk.
Yeah. We'll be able to talk. So tell us where people can find you, your website, your social media.
Cool. Ashley Steinberg, MD on Instagram, Boob Whisperer, MD on TikTok, and Peloton, if you're a Peloton subscriber. drsteinberg.com, drsteinberg.com. Call the office. I have the best coordinator area. I answer lots of my Instagram DMs. You can text the office. I'm probably answering you myself. So there's lots of ways to find me.
Very personal.
Yes.
Okay. Awesome. And if you like this podcast, please share, like, subscribe, send to all your friends and family, anybody you think that might be interested. And you can find me at www.drangelaSturm.com. Thanks for watching.
Thank you.